Hi, my name is Maddie Nance. I'm a graduate nursing student at West Texas A&M University, and today I'm going to be presenting my final practicum nursing education project. So first, I'm just going to be reviewing an overview of my project. So for my project, I worked alongside my NICU nurse educator as my mentor, um, and I hosted mock code trainings as well as I created an unplanned extubation bundle. So my next slide, I'm going to be reviewing the problem identification. And so the reason why I created this project this semester was because I saw a rise in unplanned extubation events in our unit. There were around 5 cases in our NICU over the summer, which doesn't sound like a whole lot of events, but when it's occurring in our small babies, it is a huge issue. And then next, just a need for improved patient safety and emergency training in our staff nurses when it comes to unplanned extubation events. And then, although it's not a problem, there is an increase in new graduate nurses that we're hiring, and so there definitely is a need for better emergency response training. So in this next slide, I will be reviewing my 2 personal learning objectives for my project this semester. So my first learning objective was to analyze preventable healthcare errors by new graduate NICU nurses and to develop an educational approach that highlights patient safety and improves clinical judgment. So I did this through not only my mock code trainings, but also through the unplanned extubation bundle that I created. And then in my second personal learning objective, it stated to develop an educational lesson specific to new graduate NICU nurses that addresses neonatal emergency response actions and skills to minimize or reduce healthcare errors. And so for this lesson, this was specifically addressed in my mock code trainings that I held alongside my nurse educator. So in this next slide, I will be discussing my mock code trainings. So for my mock code trainings that I held with my nurse educator, we used simulation-based trainings in our NICU. So on the left is a picture of a nurse performing PPV, or what we call positive pressure ventilation. And so they were going through the steps of NRP, which is neonatal resuscitation program, which we use in the NICU for our emergency response trainings. And so in the middle, you can see there's an infant mannequin that we used. And then on the very far right are some of the supplies that we had available to all of our nurses during the trainings. So for our scenario, we basically started like a normal shift handoff report to all of the nurses. And they received a infant that was intubated, and they had to go through all of their safety steps with the patient. So they had to ensure that the oxygen was set up correctly, the suction was set up correctly, that the ventilator settings were correct, that a drug sheet was available. And then after they received handoff, we checked to see if the nurses were checking and measuring their ET tube, doing proper handoff with the nurses, checking their equipment. And then as the scenario progressed, we wanted to see if the nurses were escalating their concerns properly in an emergency. And then once the unplanned extubation occurred in the scenario, we saw how the nurses handled it. And so we also placed some errors in the mock code itself. Like for the ET tube measurement, we had it just a little bit off to see if the nurses would catch it. We had some of the drug cards with errors on it to see if they would find the mistakes. And then at the very end, we debriefed with all the nurses, talked about what went well and what went wrong in the scenario, and how the nurses could have handled everything better. And in the end, all of the nurses said that they did feel a lot more confident in their emergency response training skills and NRP skills afterwards. So then moving on to this next slide, I'll be reviewing evidence-based research based off of my mock code trainings and simulations. So in an article by Felton and Cheshire in 2024, it talked about the many benefits of simulation training. And so one of them is that it increases confidence in our nurses, improves communication, and overall improves team dynamics. Next, it talks about how improved competency in our nurses with regular trainings can decrease mortality rates in our NICU patients. And then it also talks about how inexperienced nurses are always going to feel unprepared. And so these routine trainings and simulation-based trainings are beneficial to help improve these skills. And next, it talks about teaching staff to work as a team. So in our mock code trainings, we have all of the nurses participate and work together during the scenarios. And then also the simulation-based trainings promote a safe environment for all the nurses to ask questions without fear of actually harming any real-life patients, but they still have the experience of working through a real-life scenario. But again, they feel more comfortable and confident to be able to handle an emergency situation. And then lastly, the article talks about how NRP skills, which again is the neonatal resuscitation program, which all of our NICU nurses must be trained in for emergency response trainings, diminish within only 3 to 8 months without practice or refreshers. So this just highlights the importance of having these refreshers and simulation-based trainings for all of our nurses, especially in the NICU. So next, I'm going to be talking about my unplanned extubation bundle that I created. And so here on the left, you can see I probably created over 100 for all of our staff. But next, I'll just be reviewing all the different parts. I basically created a checklist based on our policies. And also solutionsforpatientsafety.org, which was recommended by my nurse educator mentor. And so these, I call them badge buddies, but essentially it's a little card that can fit onto all of the nurses' badges. And it just serves as a reminder and has all of our policies on it that they can refer to. So to start off, my unplanned extubation bundle, it's titled Secure Together, Every Tiny Breath Matters, NICU Unplanned Extubation Bundle. So for the first part of my bundle, I listed 2-person repositioning, and then underneath it, 1 RN and 1 RT. And so this just serves as a reminder that for any type of patient care or repositioning, x-rays, or any type of manipulation, that there must be 2 people present just to protect the airway of the patient. Next was ET tube measurement. So in the NICU, we measure at the lip with our ET tubes. I know in some PICUs, they measure at the gums. So it's important because that little bit does make a difference in our patients. And then also to measure at shift change or after any type of manipulation, again, after x-rays or repositioning. Next, the checklist and bundle lists a tube guardian, which in our NICU is primarily the respiratory therapist who guards the tube during any type of patient care. And their role is just primarily just to watch the tube, just to make sure that there's not going to be any type of unplanned extubation. Next, the bundle lists the sedation plan. So this is something that the nurses need to be addressing during daily rounding with the providers to see if the patient needs more sedation, if there's adequate sedation, if the patient is moving a whole lot and are at risk for self-extubating. Next, I listed protect and position, and this just serves as a reminder to keep our patients and their ET tube midline throughout all positioning. Next is multidisciplinary care. And so this is daily rounds with the providers and all of the healthcare team. And also just to discuss readiness for weaning. just to help get these patients extubated as soon as possible if they are ready. And then the next part was communicate ET tube position. And so if the nurse, primary nurse, is leaving the unit, they need to be communicating to other nurses the ET tube size and position. And that way, in case there is an emergency, like an unplanned extubation, the other nurses will know the size and measurement in case they have to reintubate. And then the next step was just to be prepared to have our emergency equipment at the bedside. So things like an intubation box, a drug box, stethoscope, CO2 detector, just in case we do think that a baby is extubated. And then lastly, it was to advocate, and this is just a reminder for nurses to speak up for safety and to really advocate for the patient if their tube needs to be retaped. If it's becoming real moist with the humidity in the isolates, we need to be addressing all of those concerns. But overall, these were my unplanned extubation points that I made on my checklist and bundle, and all of our nurses will now have these on their badges as a reminder. So next, just going over evidence-based research with the unplanned extubation bundle. I kind of mentioned it before, but our hospital refers to solutionsforpatientsafety.org for a lot of our policies and guidelines. This is a website that is works with a bunch of different children's hospitals to improve patient safety. They started their unplanned extubation bundle in 2018, and there was a 51% reduction in unplanned extubation events since then. So a few points that and guidelines that the website mentions was, again, having a reference point such as the lip or the gums to measure by, two-person repositioning, documentation if there is an unplanned extubation event, and then talking about extubation readiness with daily rounding with the providers, and then also audits, so reviewing how many extubation events there have been in the unit. In this next slide, I'll just be reviewing my practicum experience. So along with my project, I also had the opportunity to help my nurse educator with new grad clinical teachings. And so I got to help teach not only emergency response trainings with our new grads, but I also got to help teach basic fundamental skills like respiratory management, such as our high flow nasal cannulas, our bubble CPAPs. I also got to help teach surgical care of patients, pain management, comfort, and then just family-centered care. Our unit has a clinical academy for our new graduate nurses, which basically they have a didactic class where they go weekly, and they have like an actual class period where they do like typical like coursework and review slides and everything like that. But then they also have clinical teachings where they get to practice their skills. And then also along with this, I got to shadow my nurse educator along with some of our other pediatric nurse educators at orientation events. So it was really valuable to see how each nurse educator taught in their own ways. And so I got experience watching all of them. And then for my conclusion slide, so throughout my project, I did gain valuable experience alongside my mentor with my clinical teachings that I hope to carry into my future. Watching my nurse educator, she's been a great role model of really advocating for patient safety. And hopefully with my unplanned extubation bundle and my mock code trainings, these will help reduce unplanned extubation events in the future for our NICU. And I'm excited to see over the next few months with my bundle how this will improve our events in the future. And then in this slide, I have listed all of my references. Thank you for watching my presentation.